Hello, everyone. It's Health and Family on CITV with yours truly, Shay Dawn Burgess. We thank you for joining us. The coronavirus originating in Wuhan, China, is currently spreading across the world and has people concerned for their health. What can we do here in Bermuda to keep ourselves safe from the virus? And what is already being done by our local health authorities to prepare for this potential threat? Today, I'm here with Chief Medical Officer Dr. Cheryl Peak-Ball and Nurse Epidemiologist at the Ministry of Health, Ms. Jennifer Wilson, to answer some questions on this new virus. Thank you, ladies, for joining us.
Thank you.
So I'm going to start with you, Dr. Peak-Ball. What exactly is the coronavirus? A lot has been said about it. What is it exactly?
Coronavirus is a general term for a whole family of viruses, well known to us, ranging in severity from the common cold to very severe illness. And what's special is that the reason we're here today is that there is a new version of this coronavirus, and we call it novel coronavirus for that reason, because it is a version previously not known to the human immune system, and is therefore causing a lot of illness. Coronavirus is the general name given because they look like a crown, a bit like a crown. Corona is crown in Latin, and the virus consists of just an envelope with DNA material in the inside and proteins sticking off the top around it. And so the name for the family is coronavirus, but this novel coronavirus is a specific one.
And so it was discovered in 2019?
December 2019, there was a cluster of outbreaks in the Wuhan city area of China, clustered around a seafood and meat market. It turns out that was considered the epicenter, but it's quickly spread, and so the coronavirus, what we now know as 2019 novel coronavirus, started then and has since spread very widely.
Okay. So many of us would remember the SARS virus that I think about 10, 12 years ago. Is it similar to that?
SARS, which stands for Severe Acute Respiratory Syndrome, was another coronavirus. And so was Middle East Respiratory Syndrome, MERS coronavirus. So these are examples of other coronaviruses which cause severe illness. And this novel coronavirus is in that category, something new to the human immune system causing severe illness and spreading quite rapidly. As of mid-February, there are more than 60,000 cases, and that's quite exceptional in terms of the spread of disease, and that is why it is getting so much attention.
It has definitely dominated the headlines, without a doubt. So how dangerous is this?
Well, it varies. It depends on the individual who contracts it, but it is the fatality rate from it is not unheard of. It ranges from 2% to up to 4 or 5% for those who are hospitalized and in intensive care. But there are many, many cases of what we think may be very mild disease. The picture of the impact on a population is just evolving. So it's very unclear what all the range of diseases, but we know that it ranges from not being extremely severe to being quite a severe disease that an individual rapidly gets into decline and has to be hospitalized or in intensive care. And those are, as I said, 2 to 5% of those individuals will go on to decline and die. So that in that way, it is very serious, potentially. And the epidemiology of it is being evolved. And so it is clear at this moment that those who have a worse course are typically people who have an underlying medical condition, as is often the case for infectious disease. But it is not entirely clear what other vulnerabilities individuals might have, so that we're eager to learn that, and information is being shared very rapidly and really in an unprecedented way between hospitals and between countries, so that we get a better understanding of the natural history of the novel coronavirus.
So I'm going to bring in Nurse Wilson. Can this be transmitted from person to person, or from animal to person, or person to animal? Talk to us about that.
So Dr. Peekball spoke of the disease in humans, but the course of this, the evolution of this infection is usually that the initial source is an animal source. So it might be a bat or a cat or a camel in the case of MERS-CoV. And the thought is that these animals often have the virus, and somehow the virus evolves to be able to infect humans. There is another thought that there's a host in between that bat and human interface. So maybe somehow some intermediary host, another animal perhaps, is in between there, and then the human becomes infected from that animal.
So we're talking about a flying bat.
Yes,
Okay.
a bat, bats that you see in caves.
Yeah, I just wanted to make sure.
Bats,
All
the
right.
animal. So yes, so these new coronaviruses, this is the way they evolve. MERS-CoV, contact with camels, SARS, again, bats were a theory at that time. And again, with this novel coronavirus, bats are thought to be the source. So yes, so that initial infection happens, and then in this case, the virus has developed the capability to pass between humans. And that's where we've gotten some human-to-human spread. The spread is thought to be close. So, for example, you're 3 feet away from me. I have the novel coronavirus. I sneeze or cough, and I'm close enough that it gets in your eyes, your nose, your mouth, or I might sneeze on that surface that you touch, and you touch your eyes, nose, and mouth with your unwashed hands.
So the key is to wash those hands. So you're saying it can be transmitted from person to person.
Yes, it's thought to be close contact
Okay.
at this time.
Alrighty. And so what is the difference? I know you mentioned that it could start from a cold and then progress, or?
The symptoms. So that
Okay.
is to be clear, it doesn't begin as a cold. The cold virus is a separate type of coronavirus.
Okay.
What I was trying to convey was that the family of coronaviruses have many different specific coronaviruses in it. The common cold is one. In the case of the novel coronavirus that we're talking about today, symptoms may begin that seem like a cold. You may have a fever or a cough or start to have difficulty breathing, which is certainly not typical in the common cold.
Right.
So the symptoms are at first somewhat general, but they become more specific and more pronounced with the novel coronavirus, so that there are symptomatic similarities, but it begins at the outset as a coronavirus infection. You just don't know it. And it is important for individuals to use the same kind of hygiene that they would use in preventing someone from getting their cold that they had or their flu as with the coronavirus infection. So as you were saying, hand hygiene and cough hygiene are critical, and those are important messages that we'd like to make sure we leave this conversation having gotten across, which is that we're talking about the novel coronavirus in this moment in time, but next month we might be talking about something different. And for any respiratory illness, it's critical that people understand that there is a lot we can do to keep from getting sick. Washing our hands, keeping our hands away from our face, staying away from individuals we think are clearly sick with a respiratory illness, and just as important, staying at home when we have a respiratory illness. So those are very mundane things which actually do a lot to keep disease from spreading. If coronavirus is not in a community, it's not going to be spread.
Right.
But we're trying to prepare the public for situations where exotic new viral infections or respiratory illnesses are introduced into our community. People need to feel empowered that they can reduce their risk by the usual hand hygiene, respiratory hygiene, staying home when you're sick, not touching your face, simple things like that.
So, Nurse Wilson, who can catch the virus? Anybody or?
Anyone who is close enough in contact with someone who already has the virus. So it doesn't distinguish between age or, there is a question of whether whether it's determined by age. No, anybody of any age can catch it as long as the other person has it and is able to infect you through coughing or sneezing or, nasal discharge. So once the other person is in contact with that, they are at risk of catching it.
All right. So I know there's been a lot of hysteria and a lot of people are attributing it to China. And so one of the questions that I was actually asked to ask was if packages come from China, what should one do? And it may sound a little, little crazy, but what should one do? Like, how do we handle this?
So there's no evidence. The research is ongoing, but there's no evidence that the disease is spread through packages. This is a virus that is not hardy. It can be killed through your disinfectants that kill envelope viruses. If you read on a bottle of perhaps, I've looked at the Lysol and it says that this kills envelope viruses or coronaviruses. So it's not that hardy. And travel over days or weeks, the virus is not thought to be able to sustain that. So there's no evidence that the virus can be spread through packages that have gone through the travel from China.
But if you're in a plane where you're sort of enclosed, that's a different situation altogether.
Yes, yeah.
Alrighty, so are there any specific medicines that can help treat this?
Not at this time. As Jennifer said, research is ongoing and it is very intense research, I should say. Individuals who are interested in the research can have access to the information about what the World Health Organization is doing with all of its multitude of partners worldwide, research institutions. There's a lot of work behind the effort to find a medication to treat coronavirus, the novel coronavirus, as well as perhaps develop a vaccine against it. But at this juncture, there is only symptomatic treatment or supportive treatment. When people get sick, they are treated in hospital, given support for their respirations if they're going into respiratory failure. Sometimes kidney failure is a down the road consequence. So the care is supportive at this time for those people who get sick enough to need hospital care. As I said, the natural history of novel coronavirus infection hasn't been fully clarified. There will be perhaps information coming out that there are people who don't get very sick and have the novel coronavirus infection, because we're getting all of the attention on those who get quite ill and are in hospital. So the verdict is out on that specifically, but to answer your question, there's not currently medication for it or a virus for it.
All right, we're going to take a break at this time, and when we come back, we're going to discuss the incubation period and some more questions on this new disease, okay? We'll stay right there. We'll be right back.
Healthy people and healthy communities.
Hey, buddy. Hey, cover that cough. Here's a tissue.
Thanks.
Here's your trash. Shouldn't you be at home instead of spreading your germs to others?
Yeah, you're right.
And don't forget to wash your hands with soap and water.
Help prevent the spread of influenza. Cover your cough. Wash your hands. Stay home if you're sick. This message is brought to you by the Department of Health.
Hello, everyone. Welcome back. We are talking about the coronavirus 2019, and we have Dr. Pete Ball as well as Nurse Wilson, who are discussing everything about this and what we can do to protect ourselves. And so you wanted to correct something you had said?
Yes, I might have misspoken and said that there's no, I don't know what I said, but I wanted to say there's no vaccine developed yet. There's no medication, there's no vaccine, and that work is ongoing in that area.
Sure.
So treatment is just supportive.
Okay. So I wanted us to talk about the incubation period, because we're hearing a lot about that. Every day, the number of people that have died in China constantly is rising. So what is the incubation period, Nurse Wilson?
Research shows that the incubation period, that is the period between becoming infected and development of symptoms, is 14 days. However, there has been some research that says that it might be as low as 10 days. But we are adhering to the 14-day incubation period, and we are monitoring people who have a relevant travel history for that 14 days for symptoms.
How do you do that? I'm just wondering. I mean, it sounds we're small size, but I'm still wondering, like,
How do you?
yeah, go ahead, talk
So
on
these
that.
people are identified on arrival. Customs officers act on our behalf and ask questions about your relevant travel. They do ask, where have you traveled in the last 21 days? Because as a routine, we had 21 days when we were monitoring for Ebola. So we've left it at 21 days. And when people identify that they have a relevant travel history to mainland China, for example, they are asked as far as whether they have any signs of illness, so whether they've had a fever or a cough or shortness of breath. After that period, they are referred to a health officer, which may be present at the airport, or the health officer may be myself, for a secondary screening. So we call that a primary screening, and they would be referred, if relevant, for a secondary screening. So that at that point, that person does a risk assessment and decides what type of monitoring would be applicable to that traveler. So the monitoring might be that the traveler takes their temperature every day, and that a health officer is in touch with them every day to get the temperature reading and to ask about symptoms. Or it might be, at higher risk, a health officer attends their home every day and asks the same questions and does a face-to-face assessment. So it all depends on the risk after the risk assessment.
And so they would be quarantined to a certain extent if they were found to be.
Right, self-quarantine, and thus far we've had great cooperation from persons that are being monitored, and none of them have developed symptoms. If they develop symptoms, then they would be isolated. And depending on the level of their health, they might be transferred to the hospital.
So what is Bermuda? That is definitely a great start. What else is Bermuda doing? I mean, we're trying to do our little bit here at CITV by bringing this program, but what else is the island doing to just inform the public about this?
If I can answer that in two ways. First, I'd like to double back on something that Jennifer said about the public health practices that are in place, to highlight that these are routine public health protocols. They are generally useful for communicable diseases. So monitoring, self-quarantine, isolation, those terms are very commonly used, and those practices very commonly carried out in public health practice, that is, in preventing and controlling disease. So it is nothing exotic and unusual. Okay. It does take resources, and we do have resources to put to this. Okay. So that means that there are individuals whose jobs it is to monitor and to assist in helping people to identify when they need additional medical support. The concern that we have is that I think what we all have to accept is that public health resources are not alone adequate to keep an island safe or to keep a country safe. What we know from countries where there is human transmission, public health relies on the cooperation of individuals and their own social responsibility. And as Jennifer said, we have been quite pleased with the level of cooperation that people have, because it's human nature not to want to cause harm to others. And so generally speaking, people are cooperative when asked to self-quarantine or to isolate themselves. And they are, if they're sick, they are ill, and that certainly helps with the isolation. So those are standard public health procedures.
Okay, Nurse Wilson?
I think it's also important to note that the Epidemiology and Surveillance Unit monitor syndromes. When I say syndromes, symptoms within the community. So we have different sites that report routinely into our unit. A syndrome that might be relevant to this coronavirus is, for example, fever and respiratory symptoms. So the hospital, physicians' offices, clinics report routinely these fever and respiratory symptoms, and so that we have a baseline and can determine when fever and respiratory symptoms are elevated in the community. So this monitoring happens all the time, irrespective of this new coronavirus.
I wanted to talk about medicines. What should we be doing collectively? Is there anything we should be doing to prevent it? Or I know we talked about hand washing, but are any specific medicines? Drinking water, I'm thinking is a good thing to do. Go ahead.
There is no easy answer there because, as I said, there is no known medical treatment at the moment. The point I would want to make is that, in general, when individuals maintain their health and maintain the strength of their immune system, they're less prone to getting diseases that are infectious in nature to begin with. The unique point of this particular virus is a travel history. At this time, there is not human-to-human transmission within our community, and certainly in communities where there is no human-to-human transmission, it's always advisable to continue with hand hygiene, respiratory hygiene for all respiratory infections, maintaining one's health, taking one's chronic disease medication so that those diseases are controlled and you're less vulnerable should you get sick with something new that comes into your community. So there is no current medication, but the general advisory to people to be healthy and to do their best to maintain their well-being and to be compliant with health measures is always applicable. So even though we're talking about preventing coronavirus today, the message to wash your hands, to take your medications as directed, to maintain your health generally, that never grows old.
All right, so it was actually we were doing some workshops this week, and I noticed a lot of people, no, I really don't want to hug you and all of that. So are people doing the right thing and not wanting to hug each other, or is it just hysteria over the land? What's going on?
Well, social distancing, especially when someone is unwell, like having a cough or sneezing, or it's always best to maintain your distance. We always say, avoid sick people, and a distance of 3 to 6 feet is great. I find that during the flu season, this is flu season, and yes, we see lots of flu in Bermuda. I find that people are more apt to distance themselves during that time. I'm not sure if this is in relation to the coronavirus, but again, during the flu season, I do notice, and we do recommend that people take those measures.
I would like to speak a moment just to the question around hysteria, because this is an opportune time, I think, to point out that it is important for people to become well informed, and there is so much excellent information available on reliable, trustworthy websites like the World Health Organization or the Centers for Disease Control. We would refer individuals to that, and particularly for the local situation, we want individuals to refer to the Government of Bermuda website, its Facebook page, its Twitter account, the Tree Frog app. These are reliable sources of information, and it's very easy for rumors or for people's imagination to get the best of them, and it can be quite a diversion and a distraction to public health resources when that happens. So we encourage individuals who are thirsty appropriately for information. We're all interested to know how this is evolving and where it's going to go, but to limit their search for information to reputable scientific sites that are trustworthy, and to avoid the temptation to let their imaginations run away with them and to post things that might end up just being a distraction to the real problem and the real preventive efforts that we should all be taking.
Right, we're going to get the information on the World Health Organization website. So as far as wearing a mask, we've seen this on television. Is that necessary at this stage of the game, Dr. Ball?
Absolutely not in the situation of a healthy community. In fact, it's quite harmful to the impact on supplies if people have this reaction and want to wear a mask when there is no reason. In the setting, if you're in Wuhan, China, Wuhan City, China, a place where there is an active transmission of the virus from one individual to another, then masks become important, but it's just as important to wear a mask properly, and the hand washing becomes ever more important in that setting. And so when you ask, are masks important, they're important in certain settings. If you're caring for an individual in hospital who has novel coronavirus, absolutely, personal protective equipment is mandatory. That's how you prevent the spread. But in a normal community without the virus being transmitted, wearing a mask gives a false sense of security, can stigmatize certain nationalities. It really is, and also is an inappropriate use of resources. So we would encourage people not to take that reaction.
Did you want to tag on to that?
I just wanted to tag on to the hand washing or hand hygiene, which refers to hand washing, but also to using an alcohol-based hand sanitizer if you're unable to get access to soap and water. Okay, so but realizing that the hand sanitizer is not going to work if your hands are visibly soiled, and so that's when hand washing would be absolutely necessary. So there are those options as far as hand hygiene.
Okay, Nurse Wilson, before we go, I wanted to talk about pets because there's a little bit of alarm about that. If you could just shed some light on that quickly, yeah.
Again, there's no evidence that this virus can be spread through domestic animals, your pets. Again, the information is unfolding, but at this time, there's no evidence that domestic animals can transmit the virus.
Alrighty. Big thanks to Dr. Pete Ball and Nurse Wilson for their time today. If you want any further information on the coronavirus, please go to the World Health Organization's website, which is at www.who.int, or the Government of Bermuda's webpage, which is www.gov.bm. I'm Shay Joan Burgess. Thanks for joining us.